an adult had, say, even 10% of the problem which this child is going through, that fellow would never smile.
Today's guest isn't just a doctor. He's someone who's performed over 900 plus advanced pediatric surgeries, changing lives with hands that parents trust with everything.
You can say it is ignorance, but I would say it is innocence.
One of India's highest volume pediatric surgeons, a gold medalist, an AIIMS-trained expert. He's trained surgeons internationally, published nearly 100 scientific papers, and become one of the very few Indians to hold a global leadership position in one of the world's most respected pediatric surgical societies.
Majority of the doctors' children, the doctors themselves do not want their children to go into medicine. We are not able to convince the world that our results of treatment are good.
Beyond the awards, titles, and operating rooms, what does life dedicated to healing actually look like? This is Dr. V.V.S. Chandrasekharam on Drop the Filter.
Hi guys, I'm Ishita
And I'm Kanishka.
and welcome to
Drop the Filter.
Today we are joined by one of India's leading pediatric surgeons, a double gold medalist from Osmania and AIIMS, a surgeon trusted with the most delicate lives, globally recognized yet deeply grounded in purpose, Dr. Chandrasekharam, where precision meets purpose. Hi sir, welcome to Drop the Filter. How are you doing?
I'm good. How are you?
How was the traffic, sir?
Messy.
I mean, we're from Bangalore, so we're so used to the traffic.
And that's
being
why
a
when
problem.
you explained the issue and you were like, we totally understand.
But how was your day otherwise, sir?
Today was a busy day. So I started my work at 7 a.m. So 7:30 we started. Then we did two major surgeries on kids.
Oh my God.
One was a major kidney surgery by laparoscopy. So it's the keyhole surgery on the kidney of a 2-month-old baby.
Oh my
That's-
God.
Really sensitive.
And then we did one more surgery on a little older child, 3-year-old child. Then after that, we had a meeting. We had someone who wants to, set up a hospital in Hyderabad. So
Wow.
after that, I had my clinic where I saw some 25 patients. So, and here I am now.
That's insane.
Yeah, and thank you so much for doing
Yeah,
this for
this
us.
really means a lot. You mentioned the laparoscopic surgery that you do on kids, and you've done over 900 of these.
And I think you're the world's.
Yes.
And how is that experience? Because I feel that is something so amazing and also representing India in this. It's a big thing,
Yeah.
especially in the field of medical. So how is
How is this changing
changing
you,
and
and
also-
what has it changed in you? Your
yeah, and
perspective?
also did you always wanted to become a doctor?
That's an interesting question. Back, I'm talking about late 80s.
Okay.
In 1988, I finished my plus 2 from Sainik School, Korukonda. So again, Sainik schools, there were only about 17 or 18 Sainik schools in the whole country. So Korukonda is a Sainik school in Andhra. So I joined there in 6th class. So 6th to 12th, I was in hostel. So the tendency of Sainik school is to send cadets to National Defense Academy and then they become, officers. But my father had served in the Air Force. My father's younger brother was in the Air Force.
Wow.
And I was the only child to my parents. I mean, I am the only child to my parents. So basically, we felt that maybe, I should take a break and come into civil.
Yeah. It's
Same
needed.
like me, actually. Like my parents, my family, they're all doctors. And it's me who has just taken the rebel step to just leave the whole process.
Correct. So in my plus 2, we had both. So those days, there were only 2 options.
Yeah.
Medical
Doctor
or
engineer.
med.
डॉक्टर या इंजीनियर, आप YPC या MPC क्या लोगे? और कुछ नहीं है. बाकी सब nobody used to even talk about it. So my advantage was I did M by PC in my plus 2. There was a there was a curriculum under CBSE to do M by PC. So maths, biology, physics, chemistry. So we could go in
Any direction.
both directions. And I was pretty good at maths also. But then I asked my mother, she said, if possible, then I would actually ask you to become a doctor and not a otherwise. So that's how I wrote the EAMCET, EAMCET. That's the EAMCET entrance examination for the Telugu, Andhra, those days, Andhra Pradesh entrance examination. So we wrote that examination and then I qualified. I got a very good rank. So I joined Osmania Medical College. So it's not that I wouldn't say that, oh my God, I dreamt of becoming a doctor from childhood. I don't think we had no doctors in our family. I am the first doctor in my family, both mother's and father's side. So I didn't know what a doctor was. I didn't have any, this one to become a doctor in the sense, But I think once I entered my MBBS, then I realized that it's
Something you'd enjoy.
something I really enjoyed. From there, we took off in MBBS, Usmania Medical College. It was the best college one of the best colleges in the country, actually.
Yeah.
It was the best college in the Andhra Pradesh at that time. So then we did our MBBS, and I got a gold medal in MBBS. And then I got selected for my post graduation to two of the top institutes of the country at that time. So now we have a lot of AIIMS. There is AIIMS in almost every state now we are trying to set up. But those days, AIIMS was only one, Delhi. And then we still have PGI Chandigarh,
Yeah, my
Postgraduate Institute of this one in Chandigarh, PGI. So these were the two top institutes. So then soon after we finished our MBBS, we wrote entrance to these during our internship. Once your exams are over, then 1 year of internship you do. So in that internship, you write all kinds of entrances so I wrote the entrance to both these and I got selected into both.
Wow.
So now sometimes there is a problem of plenty. So if you get too many opportunities, then you don't know what to do.
definitely.
So of course, surgery always interested me more than medicine. So I chose surgery. So again, when it came to surgery, I was at a crossroads because I got MS General Surgery seat in PGI. Normally what you do is you do your MBBS, then you do, if you want to go into surgical field, you do General Surgery MS for 3 years. And then you write further entrances for super specialty. Then you join a 3-year course of super specialty, say plastic surgery, cardiothoracic, neuro, pediatric, onco surgery, whatever. There are so many urology, so many But the course which I did, so in AIIMS, I got this seat of a direct 5-year course in pediatric surgery.
Wow.
So that was the only seat in the whole country per year. So one seat in India
You got
per year.
it.
I got that seat.
Oh my God.
So,
Oh my
That's
gosh.
mad.
so I got MS General Surgery in Chandigarh, but I also got this direct 5-year course. So I said, why not? Because anyhow, if you do MS General Surgery, then you have to write entrance again and then you have to choose one of the subspecialties. So I said, let me go into pediatric. So that's how I ended up in AIIMS.
That's crazy
Yeah, and I
to think of.
if I just hear AIIMS, I get like goosebumps because, and also with PGI, so my sister is currently in PGI Rohtak. She's doing her, I don't know, there's so many things happening in the doctor field. I exactly don't know how to express what she's doing, but she's done her MBBS. I think she's doing a PG if I'm not wrong. So now there's so much competition and the seats are so less. So it's really like a juggle behind, to get that perfect seat, and also the perfect, depends upon numbers also what area that you get to work on. So yeah, and also you chose pediatrics. So you also will be, in and around with a lot of children. How is that experience for you?
Fantastic. See, there are two aspects of working with children. So initially, when you start working with children, you feel a little nervous because the children can't express themselves. So they cry for everything. But when they cry, you don't know whether they're crying out of pain, crying out of hunger, crying out of stranger anxiety, crying for the mom.
And the list goes on.
So the list goes on. So, so initially you are a little nervous and you're a little uncomfortable, you know.
Yeah.
But once you get the hang of it, once you start loving kids, then there is no end to, you basically fall in love with the profession itself.
Yeah.
Because we deal with so many young, innocent. No, it's the innocence.
No, of course it is.
Sometimes it's not uncommon that I make this comment that, when a small baby comes, especially we see children born with major birth defects, major birth defects which need surgical correction. So when I see a child born with a major birth defect who has undergone a major surgery and that fellow smiles at you, it's out of the world.
Sounding magical.
It's out of the world. Because then I tell the parents, I tell even my colleagues and my nurses and everybody who is there, that if an adult had, say, even 10% of the problem which this child is going through, that fellow would never smile.
For sure.
Definitely.
We would be so depressed if we had even 10% of what that child would have gone through. That child would
I
have
agree.
gone through a major congenital birth defect. He would have gone to, kind of specialist. He would have undergone all kinds of tests, including a lot of, X-rays, ultrasounds, maybe CT scans, maybe MRI scans. And then you do a lot of bloods, you draw blood every time, And then once you decide about surgery, then the baby is brought, you again give anesthesia, you do a major surgery with all the tubes hanging, the bandages. And that child is still smiling.
And so much is happening to just like, I'm telling this much size.
Yeah, you just spoke about a two-month-old baby is undergoing surgery, and I don't even think they realize the kind of pain they're going through.
That's
And you
the
know
point
the
of
kind
not
of-
knowing things.
Correct.
The
Yeah.
good point of not knowing things, what's happening.
It's the innocence.
Yeah.
Yeah,
You can say it is ignorance, but I would say it is innocence.
it definitely is the innocence
Innocence.
because they don't know what pain is. They don't know what they're going under.
The moment they see the mother, they smile.
Yeah.
The moment you kind of play with them,
Play
they
with them,
smile.
Yeah.
The moment you show them some colorful thing, they smile.
And that's what happiness is for them at that moment of time.
And they find happiness in small things.
Definitely.
So I tell my children also that you must actually come and see these small babies who have so much of problem in their life, who have undergone, gone under the knife for various surgeries and everything. Then you will understand that you are very lucky.
I agree.
God has been very kind to us. We've been very lucky. See, being born healthy, we are born healthy, our kids are born healthy, we take a lot of things for granted.
Granted. Yeah.
ठीक है भाई, क्या बड़ी बात है, लेकिन बड़ी बात है जो जिसके पास वो नहीं है, the person who doesn't have that health, then you know that, especially if it's a small child.
Yeah, I agree also with that. Like being born, also people I feel take it for granted because being born is like 1 in a million chances.
Yeah.
So I think it's just a beautiful journey. No matter if that baby is going through something, you are still born. You are the chosen one
Yeah.
by your
I
mom or
agree.
dad. Yeah. So
Because I remember my sister when she was born, she had a lot of, not something as bad as, she didn't have to go under surgery, but she had a horrible jaundice. She was in the incubator for a while. She literally came back from the death sort of situation. For I think 2-3 weeks, she was in the incubator. They were running tests every now and then, and she survived after that, obviously. And it's such a miracle sometimes because I often tell my brother that also, because I'm the eldest. I have a younger sister, and then we have a younger brother. And every time I look at him as a miracle. Not because something happened to him when he was born, but because he was planned way after. He wasn't someone who was just in the books. And when he came in, when he was born, it was such a blessing, not just for the family, but even for like my sister and I, because we see him as a child.
Yeah.
And I and him have a 9-year age gap. So I to see him like my own child. Like if he gets like even a prick, my heart hurts. So I understand what a parent must go through when so much happens to that child.
In fact, I every time I see a family, the parents coming with their child, the child has a problem, so they have to visit the doctor, they have to take an appointment, they have to come, then they have to probably wait for a while, then they see you, then the stress of guessing what the doctor is going to say
Yeah,
next.
that's
you know,
true.
the stress of the stress of thinking as to what is going to happen is worse than the actual thing when it happens.
Correct. I
Exactly.
agree.
Most of the time. Most of the time.
Yes. Because we always tend to think the worst of the situation.
Exactly.
Yes. So, and then you tell them something, and then they are, with medical or surgical management, and then they come back to you again and again, and then, these kids need some follow up.
Yeah.
They come for follow ups, and then, I salute these parents.
No, I agree
I tell you
fully.
that I salute these parents. Their patience and their love for their child, the way they take care of their child, I mean, it's unbelievable.
Because at some point you just have to sacrifice your everything for
Absolutely.
your child, which sometimes is taken for granted because you just assume parents need to do it. Yes, they do it, but I don't think there are parents who could just, if there might be like, God forbid, shouldn't happen to anyone, but if there is something like a child is born with, very easily a parent can probably give the child away. There are a lot of cases like that, which we don't really see out in the open,
Correct,
but
correct.
it's happens, and I think a lot of parents go out of their way for a child, and that's really impressive.
No, I salute them. I salute them. I salute the parents. And see, this is where every time we are reminded of our responsibility that is there on our shoulders.
Correct.
The responsibility. I always tell my junior colleagues, what is a thing that somebody loves in the world maximum? It's their child.
Yeah.
That's what I would say. A mom, there is nothing more in this world than her child.
Yeah, I think once the baby is born, maybe before it would be the husband, but once the baby is born, both of their priorities definitely change.
Absolutely.
Like I've seen some reels about how before the baby, their priorities, they mention it, my wife, and then their own parents also, but after the kid, it's just the kid. And it's just so, because obviously you're giving birth and it was inside you, for 9 months, which is, I think, something the most emotional, the purest thing that can ever happen in this
Absolutely.
evolution.
Absolutely.
And making such, like I'm just getting emotional, but it's just so,
Yeah, I think it's a very beautiful
beautiful
journey.
journey to be a parent.
Child's birth is a rebirth to the mother, actually. They go through so much. 9 months, you have born the child in your womb. You've gone through so much. And then, you've gone through the labor pains or, whatever it takes to, or a cesarean section. I was a cesarean. So, yeah, I was a cesarean. You're also cesarean. Okay. So, I was a cesarean. This was what, 54 years ago in a small village in Andhra. So, I was a cesarean. So, it is actually, my father always used to say that, I don't know whether it is actually proven, but it is said that cesarean babies are more intelligent and smart.
No, but this is actually a thing, because I have also heard it. Just because
I
you
agree.
think I'm not intelligent.
So, I was a cesarean. So, my mother had to go through that pain of the surgery,
Yeah.
So, and then once the child is born, then you detect that the child has some problem. Imagine what goes on in their minds. And if that mother is handing over that baby to me, giving me permission in written. We take a consent form, isn't it? We take a written consent, informed consent, giving me permission in written. Ki do whatever you want with my child. You cut open my child. You know, you just said that, even a pinprick to your brother would prick your heart. Now, imagine a mother who says, cut open my child and do whatever you want. So if I have to say it very crudely, cut open my baby, do whatever you want with my baby. And how much responsibility you should feel.
Correct.
Sometimes I feel, am I actually, able to bear the burden of this responsibility?
I was just gonna come to that. Like at that point of time, you will not think about your bad days. Even if you are having a bad day, I feel doctors cannot think about. I'm gonna specify surgeons basically in any field. They will not think about if they're having a bad day. They have to save a life, even if they are going through something so emotionally like tired. But that's what like doctors save lives, and they are that's why called the god of like the hospital vibes.
I don't know. I mean, adult surgery, yes, I agree. But pediatric, especially, there is a lot of emotional attachment to the
Yeah.
mother, the parents,
Exactly.
the grandparents. Many times the grandparents are more emotionally attached to the baby than even the parents.
Yeah.
No, 100%.
And if all of them are actually permitting me to do whatever I want with their child, I think it's a great responsibility.
It is.
And we should always be conscious of that responsibility. And that's actually been the endeavor that I had. That is why we started doing a lot of things which were at that point of time when I started doing. We were talking about laparoscopic surgery, the
Yeah.
keyhole surgery. I mean, when I heard somebody speak about keyhole surgery, when I read some articles on keyhole surgery, those days, I'm talking about 25 years ago, we did not have any YouTube videos, and these. It was not there. There was no social media there. So we were learning from books, and maybe in some meetings and conferences, somebody gives a talk. So adult laparoscopic surgery itself was evolving at that time. And there were very few people who could even think of doing laparoscopy in a baby, because the baby, the structure is so small.
small.
The adult abdomen will give you space to work inside. The baby's abdomen is small, so it's like you are working in a matchbox. And so then I said, if I can give my patient less pain, quicker recovery, and a scarless surgery, why not?
Wow.
Why not? See, if I can fly from here to Bangalore, why will I go by bicycle? I mean, unless I want to exercise, that's a different ball. That's a different matter.
Makes sense.
Or why will I, I mean, open surgery, I'm not discouraging open surgery. Open surgery is what we all learned. But I think we don't use the old 2000 model phone anymore, or even the 2010 model Nokia phone
all
we
about
don't use anymore. It's all
Evolving with time.
evolving,
Yeah.
and so that's how I was very, very keen to learn laparoscopy. Unfortunately, there was nobody to teach, so we had to learn on our own, and then we started teaching.
That's
So you've
great.
learned it on your own.
Absolutely. Of course, we watched some adult laparoscopic surgeons. See, the technique is the same. It's just that you're dealing with smaller babies,
It's more delicate.
more delicate, and we use much smaller instruments than the adult surgeons. So the adult surgeons use 10 millimeter instruments. We use 3 millimeter. And the diseases we deal with are different from what they deal with. But the basic thought process is the same. So I learned from some adult surgeons by observing, by assisting, and then gradually developed our own techniques of, that's how we actually developed many techniques on our own. And then we published them in international journals as to how to do a particular operation by laparoscopy safely and successfully. So both safety and success are important. Just because you're doing something new doesn't mean,
It allows you to be.
doesn't mean it is better.
Yeah.
So everything new may not be better always than the old. So you have to convince yourself that you are doing it right, and it has to be safe to the child. And obviously the success has to be comparable with open surgery. Only then that technique will survive.
Yeah, through like a lot of years.
Yeah.
That is how we evolved, and then we slowly started doing from basic laparoscopy, we went to advanced laparoscopy. So now I hardly do any open surgery. I mean, I hardly do any open unless there is a there are some cases which are not fit for laparoscopy. That's the only case where we do open surgery. Otherwise, 90% of our work is laparoscopy now.
That's insane.
Yeah.
And imagine cutting open versus 3 small holes. So this kidney operation which I did today in a 2-month-old baby, so we did with 3 small holes. One is a 5 millimeter for telescope and 3.5 millimeter holes for the instruments. So after a couple of months, if you see the child's tummy, you will be searching for a scar.
That's really amazing.
Nobody would believe that the child had a major kidney operation.
Yeah, I think because once they grow, they might be a little conscious about the scar.
Absolutely, you are absolutely right.
Because I've had a surgery, so I'm really conscious about a scar in
You
my
are
body.
absolutely. I fully agree.
Yeah, so it really takes a toll on you. So I think this is like a great option for like not for me now, but for the people who want to do it.
No, it's a great option. It's a great option, and I think it has revolutionized the way we look at surgery. The way we look at surgery, minimally invasive surgery has revolutionized the way we look at surgery. And after a major operation, you're really doing a major procedure. The very next day, the child is sitting and smiling at you, and they hardly require any pain relief. We just give them paracetamol for pain relief.
Oh my God.
Those major pain relief
Like
injections we used to give for open surgery, we are done with.
Yeah, because you get stitches done and it's really painful after the anesthesia is gone. Like it really hurts for like.
The most interesting part is the pain and the trauma of access is more than the pain of the actual surgery. For example, the case which I did today is called a pyeloplasty. Pyeloplasty is the kidney. There is a pipe attached to the kidney which enters the bladder. Basically system. It's like urology is like plumbing. Pipes and blocks. So the kidney, ureter, that's the pipe, and there's a bladder. Urine has to flow from the kidney to the bladder through the ureter without any obstruction. Now this child is born with an obstruction at the kidney and ureter junction. It's called PUJ obstruction. Child is born with that obstruction by birth. It's a manufacturing defect. ठीक है, जो pipe attach होता है वो ठीक से attach नहीं हुआ. It's not attached properly. So it is a little narrow at the junction. The rest of the pipe is okay. So the kidney has swollen. Most of the time this is now detectable on ultrasound before birth. So we knew that this baby had a problem. The baby was born, and then we waited for a month just to see if it would subside. Many of them subside spontaneously. Not all of them, but many of them. So we give time for the baby. If still not subsiding and it's actually causing an impairment of the kidney function, then you have to save the kidney. You have to go ahead and operate. My actual surgery is limited to a very small part of the body. The child's kidney, the junction. I don't touch the kidney. The junction is outside the kidney. So it's a very small part of it. Like for example, this room. You want to do something just in a, say, 10 centimeter radius here. You want to do something here. How about breaking the wall and coming inside and doing that? Versus, you put some small telescope or something from outside, pick it up and take it.
I understood. Why to destroy the whole wall when you can just make a
Yes.
hole and just get in?
So the majority of the open surgery, the trauma you create just to reach that part.
Yeah.
Just to reach that part, I have to cut open the abdomen. I have to cut the muscles of the abdomen. I have to retract the muscles. Then go inside, catch that portion, you remove the block and rejoin, and then close all the muscles and
You're telling, and I'm already getting the feeling that happened for you.
नहीं ओपन सर्जरी तो करते हैं, पहले तो बहुत किया है, but if you can do the same
thing.
avoiding all this trauma, then I think
Nothing
Why not?
better than that.
Choose a better option and a safer and a successful option.
Yeah.
That's it.
this is the difference.
No, I agree.
Yeah.
It is always better than.
So now we have trained a lot of surgeons on this. We have trained some international surgeons on this, not only across the country. We have written several papers.
You've also written a book, no, sir?
Yes, we have written 3 books. I've written 3 books. The last book is on this laparoscopic surgery in children. So it's about 70, 80 chapters. I'm one of the editors. So I've written some chapters myself. So it contains the complete, information about all what the younger pediatric surgeon needs to know about laparoscopic surgery in children. And then we have traveled throughout the country. We have done live operative workshops across the country. You name a city, I've operated there.
That's really nice.
So live operative workshops, like, you have 200, 300 delegates in the room, and then the expert comes and we demonstrate this surgery live on a child.
On a real child.
Yeah, live workshop.
That's crazy.
Like, I conducted a live workshop in Hyderabad 2 times, in 2012 and 2019. So where we invited surgeons from abroad and some from India. So I also performed some operations in this one. But that workshop I conducted. Say, they are my patients. So we take all the care that whoever surgeon is operating on that patient is actually an international expert. That's very important. Yeah. So if I'm involving somebody, that should be an international expert. Similarly, we have done workshops across the country. In fact, 2 years ago, I did a live workshop in Egypt in front of top international surgeons, not on laparoscopy, but on another surgery. So basically, it's a great learning. Of course, live operative workshops have the flip side also. They have flip side also, because the surgeon who is operating is also talking on the mic.
Yeah.
Oh my God.
And the audience will be asking questions.
This is really
The surgeon explains the technique. See, it's very simple. Suppose I did the surgery today. For example, this week, Monday, Tuesday, I conducted a training workshop for qualified pediatric surgeons. Not on laparoscopy, but on hypospadias. Hypospadias is my other specialty, my other give chance for 5 pediatric surgeons from across the country to come, and I lecture them, and I give them lectures, and then they come into the operating room. In 2 days, we demonstrate 4 operations. And they stand with me in the operating room, and I am operating, and I explain to them step by step. Okay, so in general, when I am operating, the junior who is assisting me, they also have a lot of questions. So I keep answering. It's not that, we are absolutely quiet while operating. Yes, I don't answer other phone calls when I am operating, in the sense, I don't take any phone calls. My phone is with my secretary and she takes all the calls. Unless it's a real emergency, something like this. Otherwise, she doesn't disturb. Even my wife doesn't call. She knows that I'm in a surgery. She calls my secretary if she wants to pass on some information to me, because she knows that it's a very serious business. But as long as I'm concentrating on the surgery and explaining about the surgery, I'm involved with the surgery. So, but again, so there are a lot of flip things here. But ultimately, if somebody doesn't teach while operating, how will the juniors learn?
That's true. And I was thinking about that in my
We
head.
learned because my seniors taught us while they were operating. We had a lot of questions, Why are you taking a stitch like this? What is this tissue? Why are you cutting this tissue? We want to know everything. And then if we have read about it, we will ask other questions. Why are you not doing that technique? Why are you doing? There are many ways to skin a cat. So why are you preferring this technique? Why are you not preferring that technique? So unless these are discussed and unless these are answered, we will not be able to teach somebody, isn't it? So I think it's very important for us to train the next generation.
What do you feel about the medical industry in India? What are your thoughts about it?
In the sense,
As in, do you think there should be some improvements in the medical industry in India in that perspective?
see, medical industry in India has a lot of positive side to it.
Including the government and the private both?
Yes. I'm talking about both. It has a lot of positive aspects to
I
it.
agree. I have one thing to add before you have something to say about it, because recently my friend in the UK, she is going through a lot of problems, uh, physically, I mean, health wise, and her doctor had advised her to get like some 15 tests, out of which five tests took one week because she was not getting uh, the appointment to meet with the doctor. And now when you were talking about such things, I remembered one more case where one of my friends had a fracture, and he found it easier to come back, get his cast and go back, because what he was told was he had to wait for like 1 month to get a plaster. And those things are just unrealistic as to how they can expect patients to wait.
Yeah, even the prices are very high. I think
Prices
abroad.
high is one thing, but at the other, your life is at cost.
Yeah, then too, you might have
You would
to
rather pay some
pay.
extra dollars to come back and go back than wait there 1 month, so that you don't know what can happen in a month. You cannot let your fracture just live like that for a month and things like that. So I think that way India is doing a great job, is my perception of it.
You brought about a very important point. I think you have a very keen observation, I should say, because this point is not known to a lot of common people.
I agree.
Again, as I say, if things are going on routine, you take it for granted.
Granted, exactly.
ठीक है ना? So whenever some of my patients complain of things like this, a little delay here. For example, what happens is, it's just the other day, a week or two ago, I was doing a major surgery. My junior consultant pediatric surgeon was assisting me. And then there was a child in the emergency room in our hospital with a small injury. He fell down. It was a small injury. It's not acutely bleeding. Our pediatrician had seen. We have an emergency doctor, is an emergency pediatrician had seen. So they cleaned up and then applied a bandage. But it was a deep wound and it needed suturing. See, the important thing to know is any wound will heal.
Yeah.
Nature will heal everything. Our job is to make sure it heals with minimal scar and minimal damage. So when I stitch up a wound, I stitch in such a way that it heals with minimal scar. You can't avoid a scar completely. You can only minimize the scar. That's what we do. So the pediatrician had seen the emergency doctor, cleaned it up, applied dressing, and then said, our surgeon will see, but it looks like this
Should
will
be fine.
require a stitching. Our surgeon will see and decide, please wait. Oh, they were, so obviously we were in the middle of a surgery. Both of us could not move from there and go and, this one. And they couldn't wait for half an hour to 1 hour. Oh, what is this? This hospital doesn't have doctors. I mean, come on now.
Yeah.
No pediatric surgeon is going to sit in the emergency waiting for a child with an injury, not even knowing whether the child is going to come or not. How do we know?
That's true.
So these are some things which are unrealistic.
And taken for granted.
Unrealistic. So as you rightly said, when you actually go to the West and then you experience this, then you understand that what you're getting in India is unbelievable.
Far more better.
Because at this pace, like if there's some minor issue also at home, there's a physician where we fully trust, and so we give him a call even at night. He'll always be available for anything. It's not just for our family members. We have like office staff, house help, anybody we call for, he'll immediately answer and look at the immediate best solution he could give, and then he'll be like, abhi ke liye ye karo, kal subah jo ho sakta hai dekhenge. So that is something that I think India is, I'm sure there are, I don't know, technology wise, there's a lot maybe India might have to improve, I'm not too sure. But I think in terms of immediate help, I think we're way ahead of quite a few
See,
places.
this is what I'm saying. The positive point in India is you can see a specialist whenever you want.
Yeah.
For example, I just told you that I had done this surgery on the 2-month-old baby. This 2-month-old baby would have to wait for 2 months to get an appointment with the pediatric urologist in US or UK
Yeah.
or Canada.
That's all I was thinking of in my head when you were telling this story.
उसको अपॉइंटमेंट के लिए 2 महीने वेट करना पड़ता है. सर्जरी को छोड़ो. That doctor will see, then they will order the test.
Then test
And
will
then
take
that
1
test will
month.
take another few months. And then after seeing the results, they will decide. And then the surgery date again will be given.
Yeah.
You know, they will have to wait for the appointment for surgery. So so in India, I think we have a lot of potential. We actually have a lot of potential to attract international patients,
Yes, we do.
because our surgeons, not only surgeons, our doctors are some of the best in the world.
Yeah.
Even in the US, if you see, many of the very successful doctors, very skillful doctors are Indian doctors.
I agree. A lot of them.
They are Indian doctors, very skillful. In fact, you must have heard about robotic surgery now.
Yeah.
The person who actually was the kind of mastermind behind robotic surgery and who developed the prototype of surgeries for a robo is an Indian.
Do you think they go abroad just because of a better income and lifestyle?
Yes, this is interesting. This is interesting.
I just know the answer, but I'll just
This is interesting. So, I'll give you my own example. Maybe the time has changed now. Maybe it is changing now. But at least, but even now, I know a lot of Indian doctors want to go abroad, even now. But in our days, it was very rampant. See, we were about, in Usmania Medical College, we didn't have so many seats in MBBS as we have now. So, in Usmania Medical College, we had about 150 was our strength. 150 seats were there per year, MBBS. I think out of 150, 20 or maximum 30 may be in India. More than 100 are abroad.
Yeah, that's what, even like if I consider my dads and all, half of them have moved abroad.
Some are in UK, but majority are in the US.
US.
Yeah.
What is the reason? So we were a group of 5 friends, very close friends. 4 of them are abroad. I mean, 3 of them are abroad rather. The 4th one tried but failed. I was the only one who never tried. Soon after MBBS to leave. There are many reasons for this. I think the one reason is the fear that you may not get a seat of your choice in India. I mean, the specialty of your choice.
Yeah.
Especially if you are an open category candidate. So that's one aspect of it. The second aspect of it is this is where I am coming. In India, medical care is excellent, but there is no personal life for the doctor.
Exactly. Like
You understand? It's very difficult to draw a line.
There's no balance whatsoever.
There is no balance. Matlab, system is not well developed.
Yeah.
Most of the care is based on the individual responsibility and individual expertise. You understand what I'm saying? So, the system itself doesn't support the doctor.
even I think with safety.
So, इसमें क्या है? इसमें it's a very delicate balance. See, as I said, for example, you said that you could call your doctor at any time and he would lift the phone. What happens is, suppose it was the West, what they would say is, you will have to, even if you have your doctor there. But when the doctor is not available, you would have to go to the alternative who is on call or who is on duty, at least for that point of time. आपको emergency है, बच्चे को कुछ बुखार है या आपको कुछ बुखार है, something like that. So if you are regular doctor, obviously that he may be on a weekend off or something, then whoever is available, obviously somebody will be looking after the emergency. So you will have to go to the doctor. Unfortunately, in India, what happens is majority of the parents or patients rather, I say parents every time because I deal with kids, but majority of the patients may not be comfortable with seeing a new doctor.
That's true. Because that trust is once built, it's difficult to find.
That from a patient's point of view, I would say that's absolutely appropriate, and maybe I would do the same thing if I were a patient.
Patient.
If I was on the patient's side, I would probably want to meet my regular doctor and not a new doctor. Coming from the doctor's side,
You can get a call anytime.
this is something which I think this needs a balance.
I think in India specifically, of course, doctors face it, but I think every profession faces that. Whether it's corporate, whether it's doctor, engineer, any profession, I don't think there's a work-life balance happening anywhere. That is something that I really appreciate in the West.
So my friends, whoever have gone abroad, or even my juniors, who have gone abroad, have cited these reasons. For example, I have a junior, a few years junior to me in the medical college from Hyderabad. Whole family of doctors. This guy was brilliant. He became a radiologist. And then he went abroad and he did a fellowship in pediatric radiology. He's an expert pediatric radiologist. And even in pediatric radiology, he went further deep. He is one of the few guys internationally, who can do certain procedures in children. I always used to tell him, why don't you come back to India? Why don't you come back to Hyderabad? Why don't you give back? Because in Hyderabad, we don't have a single pediatric radiologist. I don't think even in Bangalore you have. Like the general radiologist will look after the pediatric X-rays, ultrasounds and CT scans and all also. But there is no fellowship trained or somebody who was specially trained in pediatric radiology and someone who does his entire work in pediatric radiology. So I told him that why don't you come back to Hyderabad? We all badly need a pediatric radiologist. Suppose I have a CT scan which I want a radiologist to interpret. The way a pediatric radiologist will interpret a CT scan of a small baby, because that person would know the pathology that can occur in a small baby. Whereas for a general radiologist, a 90-year-old adult and a 9-month-old baby are almost the same. So, although yes, some of them are good, but then, so I asked this guy, why don't you come back to Hyderabad? We will all make use of your services. You will become very busy. He said, exactly, that is why I'm not coming back.
Valid, honestly.
He says,
It's really bad.
I work here 5 days a week. Weekend I am off. Whenever he's on call, it's okay. But otherwise, when he's off, he's off. 9 to 5 job. Nobody disturbs him after 5. Nobody disturbs him after 5. So he says, अगर मैं इंडिया आऊँगा तो तुम लोग मेरे को रात को 12 बजे भी छोड़ोगे नहीं. यार एक बच्चा आया, उसको ट्रॉमा है, सीटी स्कैन हमने किया, अब बोलो कि उसका लिवर कैसा है, स्प्लीन कैसा है. अरे यार छोड़ो.
Yeah, I think even in addition to that, like what I've seen with my parents is, imagine she goes only to my parents. So if she has a relative and they want to get something, so it becomes a chain. Then unko call karo, abhi baat karao, and then my dad is like, they like, please dekh lo, हमारे बहुत close relative है. So it becomes a chain, and then my dad doesn't have a choice. Like he has to, even if it's at 12 a.m., he has to, because I think we are more emotional as Indians.
So there is, from the patient's perspective, yes, I agree that there is a lot of, trust involved, a lot of emotion involved, a lot of confidence involved. Yeah. But from the doctor's side, if you see, they too should have a life.
Yeah,
I think I've just seen my dad.
They should have a life. Their family should have a life. Unfortunately, what's happening in India now is majority of the doctors' children the doctors themselves do not want their children to go into medicine. And many of the children are also seeing their father or mother or parents, work without any, kind of schedule. And then they say, yaar, bahut ho gaya. My son said, in fact, I asked him hesitatingly, that, kya karega tu doctor? What do you think? No, no way.
Valid.
Yeah, I've actually done my I've done my 11th and 12th in medical. I've filled the NEET exam, but I did not fill it because that time also when I was passing my 12th, my dad was in PGI giving like studying for his MD, and I was like, I can't like I also want my own life, and my sister was also that time giving her own. She was in her MBBS, and she used to study every day. Like I have what we see in the college may you don't have to study that much. She's studying every day. So I did not give my NEET exam. End of the story.
So this is one problem with medical profession in India. The other problem, the organized part of it is slightly disorganized. I'm being very modest here, so I'm downplaying it. So that is a problem. The positive side, as I said again, let's talk positive. Positive side is the kind of experience and expertise Indian doctors have is unbelievable. Because we obviously see more patients, we obviously operate on more patients, so technically we are very good. But the flip side is, again, as you said, government hospital. The flip side is they're overworked. Government doctors are overworked. So when they are overworked, they can't concentrate. You see, as a surgeon, I can tell you, normally I ask my secretary to restrict to 2 cases per day. If possible, 1 major, 1 not so major. Otherwise, max 2 majors. I cannot do more than that. I'm a human being. I cannot do more than that.
It also takes a toll on your
Absolutely.
life.
The stress, na? Stress आप इतना stress करेंगे. But unfortunately, the government doctors don't have that option. Government में वो option नहीं है. So they'll have to handle all the numbers that they get. They have to handle all the numbers that they get. So उनका concentration obviously, तो वो first patient of the day को जो वो procedure करेगा और last patient में जो करेगा उसमें तो फर्क होगा. Because we are human beings. I mean, if you have, last year I was in Europe for a conference, we had a tour also. Even the drivers there, the car and the bus, we had a bus. So the bus drivers there, they have very strict hours of driving and very strict hours of rest. You cannot drive for more than so and so hours at a stretch. You have to get a half hour or 1 hour break after so many hours of driving. It's absolutely, very strict. It's very strict and it's monitored.
Yeah.
The problem क्या है? India में there may be rules. But
Nobody follows it.
and nobody monitors. Following तो अलग है. Monitor भी नहीं करते.
People just make rules just for the telling to the
कि ये
country
exist करता
and telling
है.
to the world also in like
गवर्नमेंट डॉक्टर्स में या डॉक्टर्स जो बहुत बिजी रहते हैं, उसमें प्रॉब्लम क्या है कि उनको पढ़ने के लिए, नया चीज सीखने के लिए उनको टाइम नहीं मिलता है. दे ऑल्सो डोंट गेट टाइम टू डू एकेडमिक वर्क. आपको एक एकेडमिक वर्क करना है. सपोज मैंने 100 केस किया है, तो वो केस का रिकॉर्ड मेंटेन करना है मुझे. And I'll have to follow up my patients. See, how will I know the results of my surgery unless I follow up my patients? Follow up is very important. So I have to follow up my patients. So if I don't have time to follow up, if I don't have time to finish my surgery itself, how will I follow up the patient? And if I don't follow up, how can I tell the world what the problem, the biggest hindrance for India is that we are not able to convince the world that our results of treatment are good. Because if you ask most of the senior or the busy doctors, oh, we have done hundreds of cases and everybody is doing well. I mean, come on now. Everybody can't do well. You know, a driver says, I've driven for 20 years, I didn't ever had an accident. I think either he has never driven or he is lying. You know, so it's very important for doctors to maintain records, to maintain the data. And then once you have the data, you can tell the world. And once you tell the world, and once you convince the world with your data that we are able to give equal results or better results than the West, then a lot of patients will come to you. A lot of patients will come to you because here medical expenditure is very cheap. We have one of the cheapest medical systems in the world. High quality I'm talking about.
Yeah, no, that
High
is true.
quality.
Because we recently met with a cancer specialist, throat cancer specialist, and we had hosted him as well, Dr. Vishal Rao. He was one of the first in India after US and UK to create a voice box for $1. And it was insane because his was also the same ideology where he wanted to be accessible to everybody and anybody. Because people who are rich can definitely afford the ones in the US, but him, when he was treating a security guard, he didn't know how to, with what mouth would he say that this is the amount of that voice box that he needs. And that's when he came up with and built his own. And where after US and UK, I think India is the one who's producing a voice box for throat cancer, which is crazy. So it is true. We do have a very lenient fare for all kinds of.
Very affordable healthcare we have got. Very affordable. And very quick. Response is quick, very affordable healthcare, expert doctors. These are experienced, huge experience. These are our USPs.
Yeah.
The flip side is, as I told you, doctors are overworked, they don't have a personal life, and then in government hospitals especially, the salaries and pay are definitely much less than what the amount of work that you do.
True.
At least in government. In private, it's reasonable, but in government, it is definitely much less. So, we need to improve on these sectors, and then we need to obviously, play to our strengths.
Yeah.
Yeah, I think that's really important. Also, I have a quick rapid fire for you. Surgery or teaching?
Teaching surgery.
Tea or coffee?
I'm a tea man.
Early morning surgeries or late night surgeries?
Not late night. I don't operate early mornings also. So, I operate a little late in the day. Yeah.
One thing you do to relax.
Music.
And by ending, we have a drop the filter question for you. What would you tell your younger self? Like looking, yeah,
An advice you'd give your younger self.
Younger
self.
self.
Yeah, an advice you want to give your younger self, just for.
Younger self. What would I say? I never thought about this.
Now is
You
your
did
time.
it. Something like that.
Even if it's not an advice, something you'd
Yeah.
want to tell your younger self. Like if
That
you're
you-
looking at yourself
yeah.
like 20 years ago, what would
Like
be the-
imagine you went to the past and you're looking at your younger self now. What would you tell?
Yes. This is where, I would give us little, longer answer to this. Most doctors, I'm not saying all, most doctors have poor financial knowledge. Most doctors. I don't know if you know this, your family, you have a family of doctors. We're not very good at managing finances or so-called wealth creation or whatever you may say. So I think doctors also should learn. Of course, now there are actually a lot of courses going on and a lot of doctors are going into these, investments and shares and other things. But basically, I think I would ask my younger self to be more financially wise.
I think that's a great advice because it's as much as you're successful, and I'm telling in a perspective of your emotion and well-being, you also have to be financially independent and successful in life. And I think that's a really good advice because I think every children nowadays need to know that because the expenses of everything is just on the roof.
Yeah.
So yeah, I think that's a very a positive end to end the episode. And thank you so much for coming here. You have been a great inspiration.
It's a pleasure. It's a
That's-
pleasure.
And yeah, I'm like, we just love doctors and they've done so much for obviously our country. Thank you so much for being a part of it.
It's a pleasure to meet you both. Thank you. Thank you so much.
We'll see you next Friday.
Bye-bye.